Have you ever noticed how climbing stairs, something that used to be so easy, now feels like a mountain to climb? If you've experienced this, you're not alone. After the age of 50, many people start to notice a decline in leg strength, and this can make even the simplest tasks feel much harder. But here's the good news. You can take control of your leg health and regain your strength, no matter your age. Our legs are the foundation of an active, independent life. However, if you're noticing weakness, it could be a sign that something's happening beneath the surface. So, how can we restore strength and maintain independence in life? Don't worry. Today, we're diving into the 10 most common causes behind this issue, and more importantly, what you can do to improve your condition starting today. Let's embark on this journey together and explore how to keep your legs strong and your independence intact. Before we get started, don't forget to leave a comment below and tell me where you're tuning in from. And stick with us. Solutions to strengthen your legs are coming up right after this. 1. Age-related muscle loss, sarcopenia. Let's kick things off by diving into sarcopenia, a natural part of aging, but one that doesn't have to define our experience as we grow older. Sarcopenia is the gradual loss of muscle mass and strength, which typically starts in your 30s and accelerates after the age of 60. While it's a normal part of the aging process, it's one of the leading causes of leg weakness and difficulty with mobility as we get older. Think of it this way. When you're young, your muscles are constantly being rebuilt and maintained. But as you age, your body's ability to repair and grow muscle slows down. This can leave you feeling weaker, especially in your legs, and make activities that once seemed simple, like climbing stairs or walking long distances, feel like a major challenge. Now, here's the good news. Sarcopenia is not a life sentence. With the right approach, you can slow down or even reverse some of the effects. Let's break it down with some practical steps. What you can do about it. 1. Resistance training. One of the most effective ways to fight sarcopenia is by incorporating resistance training into your routine. This doesn't mean you need to hit the gym with heavy weights or perform complex exercises. Simple tools like resistance bands or light dumbbells can be incredibly effective in rebuilding muscle mass. Even exercises like squats, lunges, and leg presses can significantly improve your strength. Just 20 to 30 minutes of strength training 2 to 3 times a week can make a big difference. 2. Protein-rich diet. Alongside exercise, what you eat plays a crucial role in preserving and building muscle. Protein is the building block of muscle, so it's essential to make sure you're getting enough of it. For example, lean meats like chicken and turkey, fish, eggs, and even plant-based proteins like lentils, beans, and tofu can help nourish your muscles and keep them strong. A general guideline is to aim for about 1.2 to 1.5 grams of protein per kilogram of body weight if you're over 50, depending on your activity level. Example, John's journey. Let me share the story of John, a 62-year-old who struggled with climbing stairs and found walking long distances exhausting. John noticed his leg muscles felt weaker over time, and simple tasks became increasingly challenging. At first, he thought it was just part of getting older, but after reading about sarcopenia, he decided to take action. John started incorporating simple resistance band exercises into his daily routine, focusing on his legs and core muscles. He also adjusted his diet, making sure he included chicken, eggs, and plenty of beans in his meals. After just a few months, John began to notice a difference. His legs felt stronger, and climbing stairs no longer felt like a struggle. In fact, he could even take longer walks without feeling fatigued. Moral of the story, even if you're in your 60s or beyond, you can fight back against muscle loss. And it all starts with a consistent approach to exercise and nutrition. Remember, it's never too late to start. 2. Peripheral neuropathy, nerve damage. Let's talk about another reason your legs might be feeling weaker, peripheral neuropathy, a condition that can affect the nerves in your legs and feet. Peripheral neuropathy is most commonly caused by diabetes, but it can also result from other factors like alcohol abuse, infections, or certain medications. When the nerves in your legs are damaged, the communication between your brain and legs becomes impaired. This can cause a variety of uncomfortable symptoms such as numbness, tingling, pain, and weakness. How peripheral neuropathy affects your legs. Peripheral nerves play a crucial role in sending signals from your brain to the muscles in your legs, allowing you to move and feel. When these nerves are damaged, the signals slow down or become distorted, leading to numbness. You may lose sensation in your legs or feet, which can make it hard to sense where your feet are in space. This is dangerous, as it can lead to accidents, falls, or injuries since you might not feel pain if you step on something sharp or hot. Pain. Damaged nerves can send abnormal pain signals to the brain, causing sharp, burning, or shooting pain that feels like a constant ache. Weakness. Because your nerves aren't transmitting the proper signals, your muscles may not get the message to contract properly, leading to muscle weakness, making it difficult to walk or even stand for long periods. What can you do to manage peripheral neuropathy? The good news is that you can manage peripheral neuropathy and slow its progression. While the nerve damage itself may not always be reversible, there are steps you can take to improve your quality of life and alleviate symptoms. 1. Control your blood sugar levels. If you have diabetes, the most important step in managing neuropathy is to keep your blood sugar levels under control. High blood sugar can damage nerves over time, so maintaining a healthy diet, taking prescribed medications, and monitoring your blood sugar regularly can help prevent further nerve damage. Speak with your doctor about the best approach for managing your blood sugar. 2. Eat nutrient-rich foods. A balanced diet rich in vitamins and minerals can help nourish your nerves and improve their function. Focus on foods that are rich in B vitamins, such as whole grains, leafy greens, and lean meats, as they are essential for nerve health. You might also consider incorporating omega-3 fatty acids, found in fish like salmon, into your diet, as these are known to reduce inflammation and improve nerve function. 3. Exercise regularly. Staying active is crucial when dealing with peripheral neuropathy. Exercise helps improve blood circulation, which is vital for nerve health, and it also strengthens muscles, which can reduce feelings of weakness. Low-impact activities such as walking, swimming, or cycling are excellent options for people with neuropathy, as they are easier on the joints while still providing significant benefits. Balance exercises and activities like Tai Chi can also help reduce the risk of falls. 4. Pain management. If you experience pain from peripheral neuropathy, there are various treatments that can help. Over-the-counter medications like ibuprofen or acetaminophen can help with mild pain, but your doctor might recommend other treatments like antidepressants or anticonvulsants that are sometimes used to treat nerve pain. In some cases, topical treatments such as capsaicin creams or lidocaine patches can provide localized relief. 5. Regular health check UPS. Regular visits to your healthcare provider are essential to monitor the progression of peripheral neuropathy. Your doctor can help adjust medications, offer new treatment options, and ensure that you're staying on track with your management plan. If you experience new symptoms like increased numbness or tingling, make sure to discuss them with your doctor right away. Example: Lisa's journey with peripheral neuropathy. Let's take a look at Lisa, a 55-year-old woman who had been living with type 2 diabetes for several years. Over time, she began noticing tingling and pain in her feet, which progressively worsened. She found it difficult to walk long distances, and her balance started to suffer. At first, she thought the pain was just a normal part of aging, but when she mentioned it to her doctor, she was diagnosed with peripheral neuropathy. Lisa's doctor worked with her to create a personalized plan that included tight blood sugar control, nutrient-dense meals, and a regular exercise routine. Lisa made it a priority to walk every morning and incorporate gentle stretching and balance exercises into her day. Over time, she noticed a significant improvement in her symptoms. The pain became more manageable, and she regained strength in her legs, making it easier to walk without fear of falling. The takeaway from Lisa's story is that early intervention and consistent management are key to reducing the impact of peripheral neuropathy. With the right approach, you can maintain an active lifestyle and protect your legs from further damage. 3. Peripheral artery disease, PAD. Let's dive into another common cause of leg weakness: peripheral artery disease, PAD. If you've ever experienced discomfort, heaviness, or pain in your legs while walking, especially after walking for even short distances, it could be a sign of PAD. This condition occurs when plaque, which is made up of fatty deposits, cholesterol, and other substances, builds up in the arteries, causing them to become narrow and restricting blood flow. As a result, your muscles don't receive enough oxygen and nutrients, which can lead to weakness, cramping, and even pain. How PAD affects your legs. When the blood vessels in your legs are clogged or narrowed, the flow of oxygenated blood to the muscles is reduced, leading to the following symptoms: leg pain or cramps. You may experience discomfort in your calves, thighs, or buttocks while walking. This condition, known as claudication, causes pain because the muscles aren't getting enough oxygen during physical activity. The pain usually subsides when you rest, but it can return with continued exertion, heaviness, and weakness. In addition to pain, your legs may feel unusually heavy or weak, making it harder to walk or perform everyday tasks. You might notice that you're easily fatigued or struggle to walk as far as you once did without needing to stop and rest. Cold or numb legs. In severe cases, the lack of blood flow can cause the legs to feel cold to the touch, or you may experience numbness or tingling sensations. If this happens, it's a sign that the condition has progressed and needs immediate attention. Slow healing of wounds. Because of poor circulation, cuts, sores, or blisters on your legs may take longer to heal, and they could potentially become infected. What can you do to manage PAD? While PAD can be a challenging condition, the good news is that lifestyle changes can significantly improve your symptoms and help you manage the disease. The earlier you take action, the better you can prevent further complications. 1. Quit smoking. Smoking is one of the primary risk factors for PAD. It damages blood vessels and contributes to the buildup of plaque. Quitting smoking can improve circulation and significantly reduce your risk of PAD worsening. If you're a smoker, talk to your doctor about smoking cessation programs or treatments that can help. 2. Control your blood pressure and cholesterol. High blood pressure and high cholesterol are major contributors to plaque buildup in the arteries. If you have either of these conditions, it's essential to manage them through medication, if prescribed, and lifestyle changes. Eating a heart-healthy diet, exercising regularly, and monitoring your blood pressure and cholesterol levels are key to slowing the progression of PAD. 3. Exercise regularly. One of the most effective ways to improve circulation and combat the symptoms of PAD is regular physical activity. Walking is an excellent exercise for people with PAD because it helps promote better circulation and strengthens the muscles in the legs. Start with short walks, then gradually increase the distance as your legs become stronger. Aim for at least 30 minutes of walking most days of the week, but make sure to listen to your body and rest if you feel pain or discomfort. 4. Adopt a healthy diet. Eating a diet low in saturated fats and high in fruits, vegetables, whole grains, and lean proteins can help reduce the plaque buildup in your arteries and improve circulation. Foods rich in omega-3 fatty acids, like fish, nuts, and seeds, can also help reduce inflammation and prevent further damage to blood vessels. 5. Foot care. Because PAD can affect the blood flow to your feet, it's crucial to take extra care of them. Regularly check your feet for cuts, blisters, or any unusual changes, as poor circulation can make it harder for wounds to heal. Ensure you wear comfortable shoes and socks to avoid foot injuries, and visit a podiatrist if you notice any issues. 6. Medication. In some cases, doctors may prescribe medications to help manage PAD. Statins, for example, can help lower cholesterol levels, while blood thinners, like aspirin, can reduce the risk of blood clots. Cilostazol, a medication used to improve walking distance for people with PAD, may also be prescribed to help improve leg circulation. 7. Medical procedures. If PAD becomes severe and lifestyle changes and medications aren't enough, there are procedures available to help restore blood flow. For example, doctors may recommend angioplasty, a procedure to widen the blocked arteries, or in some cases, surgery to bypass blocked areas of the artery. 4. Vitamin D deficiency. Let's talk about something that many people overlook, especially as we age: vitamin D deficiency. If you've noticed that your muscles feel weaker or you're more prone to falling, it could be due to a lack of vitamin D in your body. This essential nutrient plays a vital role in muscle strength and bone health, and its deficiency is a common issue among seniors. As we age, our ability to produce vitamin D naturally from sunlight diminishes, and this can lead to a weakened musculoskeletal system. Without enough vitamin D, our muscles aren't able to function at their best, which increases the risk of falls and fractures, two common concerns for older adults. How vitamin D affects muscle strength. Vitamin D is crucial for the absorption of calcium, a mineral that strengthens bones and supports muscle function. When there is a deficiency in vitamin D, calcium absorption becomes less efficient, leading to weakened bones and muscles. This can make it more difficult to perform physical tasks, and as a result, your legs may feel sluggish or fatigued, and balance issues may arise. One of the key roles of vitamin D in the body is maintaining muscle function. Studies have shown that individuals with low vitamin D levels tend to have weaker leg muscles, and they may struggle with activities like climbing stairs or even walking for extended periods. In fact, one of the primary risks of low vitamin D is the increased risk of falls. Weak muscles and poor balance can make even simple movements more challenging, putting you at risk for injuries that can affect your mobility and independence. Common symptoms of vitamin D deficiency. If you're wondering whether you might be low on vitamin D, here are some symptoms to look out for. Muscle weakness. As mentioned, low vitamin D can cause your muscles to feel weaker. If you find yourself feeling unusually tired or unable to lift or carry things you once could, this might be a sign of a deficiency. Bone pain. Vitamin D is essential for bone health. Without enough of it, you may experience joint or bone pain, especially in the back, hips, or legs. Frequent falls. As your muscles weaken and your balance deteriorates, you may be more prone to falls. Falling is one of the leading causes of injury among older adults, and it's directly linked to insufficient vitamin D. Fatigue and depression. Deficiency in vitamin D has also been linked to feelings of fatigue and depression. If you've been feeling unusually tired or have noticed changes in your mood, it could be connected to low levels of this important nutrient. What can you do to boost your vitamin D levels? Fortunately, there are several ways to increase your vitamin D levels and improve muscle strength and overall health. Here's what you can do. 1. Sunlight exposure. The best natural source of vitamin D is sunlight. Spending 10 to 15 minutes outside a few times a week can help your skin produce vitamin D. Try to expose your face, arms, and legs to the sun, but be mindful not to overdo it. Excessive sun exposure can increase the risk of skin damage. The amount of sunlight needed varies depending on factors like skin type, location, and time of year, so be sure to adjust accordingly. 2. Vitamin D-rich foods. Incorporating foods that are naturally rich in vitamin D into your diet is another way to boost your levels. Here are some excellent sources of vitamin D. Fatty fish, salmon, mackerel, and sardines are excellent sources of vitamin D. Aim for at least 2 servings of fatty fish per week. Fortified foods. Many foods are fortified with vitamin D, such as fortified milk, orange juice, and cereals. Check the labels to find these fortified options. Egg yolks. Eggs, especially the yolks, contain a small amount of vitamin D. Including them in your diet is an easy way to boost your intake. Mushrooms. Certain mushrooms, like maitake and shiitake, contain vitamin D, especially when exposed to UV light during growth. These can be a great plant-based option. 3. Vitamin D supplements. If you're unable to get enough vitamin D from sunlight or food, supplements are an effective option. Vitamin D3, cholecalciferol, is the most commonly recommended supplement, as it is more effective at raising vitamin D levels in the body. However, it's important to consult with your doctor before starting a supplement, as they can recommend the correct dosage based on your specific needs. 4. Balance your diet. A diet rich in calcium and magnesium is also important, as these nutrients work together with vitamin D to support muscle and bone health. Consider foods like leafy greens, nuts, seeds, and dairy to ensure you're getting all the essential nutrients for overall health. 5. Monitor your levels. If you're concerned about a vitamin D deficiency, it's a good idea to have your levels checked by a healthcare professional. They may recommend a blood test to determine your vitamin D status, and based on the results, they can suggest specific adjustments to your diet or lifestyle. 5. Sedentary lifestyle. As we grow older, the sedentary lifestyle becomes one of the most detrimental factors to our physical health. It's a hidden threat, gradually chipping away at our muscle strength, flexibility, and overall mobility without us even realizing it. When we spend long periods sitting or lying down, our muscles don't get the necessary stimulation to stay strong and functional. Over time, this leads to muscle atrophy, the shrinking and weakening of muscles, which directly impacts our ability to perform everyday tasks, such as walking, climbing stairs, or even standing up from a chair. Why a sedentary lifestyle is harmful. Muscle atrophy doesn't happen overnight. It develops gradually. When we remain inactive for extended periods, the muscles in our legs and body begin to lose their tone and strength. This process can start as early as in our 30s, but becomes more noticeable and significant as we get older. The lack of movement disrupts blood circulation, which in turn deprives muscles of the nutrients and oxygen they need to stay healthy. As a result, muscle mass decreases, and mobility is significantly reduced. Muscle atrophy is not just about weakness. It also affects balance and flexibility. When the muscles that support our legs and core become weak, it becomes much harder to stay upright and maintain balance. This can lead to falls and injuries, particularly in older adults who are already at risk. Additionally, sedentary habits can also contribute to joint stiffness and poor posture, both of which make movement even more challenging. How a sedentary lifestyle affects your mobility. As you age, the effects of a sedentary lifestyle can become even more pronounced. Sitting or lying down for too long means you're not using your muscles as much, which ultimately leads to reduced flexibility and strength. Here are some of the most noticeable effects of inactivity on your body. 1. Weakening leg muscles. The muscles in your legs, such as your quadriceps and hamstrings, are crucial for basic movements like walking, standing, and climbing stairs. When these muscles aren't regularly used, they lose their strength, and you may start to feel more fatigued or unsteady when trying to move. 2. Impaired balance and coordination. Our legs and core muscles are essential for maintaining balance. When these muscles weaken due to lack of activity, it becomes harder to stay upright, which increases the risk of falls. In fact, a lack of balance and coordination is one of the leading causes of fall-related injuries in older adults. 3. Decreased flexibility. Sitting for prolonged periods, especially in a sedentary position, leads to stiffness in the joints and muscles. Over time, this reduces your range of motion and makes it harder to perform everyday movements, such as bending down or reaching for something on a shelf. 4. Reduced circulation. Lack of movement can impair blood circulation, especially to the legs. This can result in feelings of heaviness or tiredness in the legs and may also increase your risk for conditions like deep vein thrombosis, DVT, or varicose veins. The power of movement. The good news is that you can fight back against the negative effects of a sedentary lifestyle with just a few simple changes to your daily routine. Regular movement and exercise are key to maintaining muscle strength, flexibility, and balance. Even if you've been sedentary for a long period of time, it's never too late to get started. Here are some simple ways to combat a sedentary lifestyle. 1. Walking. One of the easiest and most accessible forms of exercise is walking. It requires no special equipment and can be done anywhere. Try taking a 10 to 15-minute walk around your neighborhood or even indoors. Walking not only helps build strength in your legs, but it also promotes better circulation and joint mobility. 2. Swimming. For those who have joint issues or find walking too strenuous, swimming is an excellent option. The buoyancy of water supports your body, reducing the impact on your joints while providing a full-body workout. Swimming helps improve muscle strength, flexibility, and cardiovascular health, all without the risk of injury. 3. Tai Chi. This ancient Chinese practice focuses on slow, controlled movements that help improve flexibility, balance, and strength. Tai Chi has been shown to reduce the risk of falls in older adults and can be a great option for those who prefer low-impact exercise. It's also a great way to reduce stress and improve mental focus. 4. Strength training. Incorporating light strength training into your routine, even just 2 or 3 times a week, can make a huge difference. Resistance exercises, such as using resistance bands, dumbbells, or even bodyweight exercises like squats, lunges, and push-ups, can help rebuild muscle strength, prevent atrophy, and improve overall mobility. 5. Stretching. Regular stretching is essential to maintain flexibility and prevent stiffness. Simple stretches like hamstring stretches, calf raises, and hip openers can help keep your muscles limber and reduce the risk of injury. Stretching also promotes better circulation and can relieve tension in the muscles. 6. Chair exercises. If you have difficulty standing for long periods of time, chair exercises can be a great alternative. Seated leg lifts, seated marches, and seated arm raises are all simple exercises that can help build strength and improve circulation without requiring you to leave your chair. 7. Stand up and move. If your work or daily routine involves sitting for long periods of time, Try setting an alarm every hour to remind yourself to get up and move for 5 to 10 minutes. Even small bursts of activity can help improve circulation, reduce stiffness, and prevent the long-term effects of sitting. The importance of consistency. The key to reaping the benefits of any physical activity is consistency. It's not about doing intense workouts every day, but about integrating movement into your routine regularly. Starting small and gradually increasing your activity level will help you build strength and improve your overall fitness without overwhelming yourself. For example, consider Mary, a 72-year-old woman who had spent years leading a sedentary lifestyle. She noticed her legs were becoming weak, and she struggled with basic tasks like carrying groceries or climbing stairs. After speaking to her doctor, Mary decided to start with 10-minute daily walks around her neighborhood. She also incorporated simple stretching exercises into her routine. After several weeks, she noticed a significant improvement in her strength and mobility. Mary's experience shows that even small changes in activity can lead to powerful results. 6. Osteoarthritis. As we age, the cartilage in our joints begins to wear down, a condition known as osteoarthritis. This is one of the most common causes of joint pain and stiffness, especially in weight-bearing joints like the knees, hips, and spine. When cartilage breaks down, the bones in the joint can start rubbing together, leading to inflammation, pain, and sometimes swelling. This can result in weakened muscles surrounding the affected joint, which makes it harder to move freely and comfortably. Osteoarthritis often causes a vicious cycle. Pain leads to reduced activity, which in turn leads to further muscle weakening, making the condition worse. How osteoarthritis affects the body. Osteoarthritis doesn't just affect the joints themselves. It can also have a significant impact on the muscles and tissues around the joint. As the cartilage thins and the bones begin to grind against each other, it can cause pain, stiffness, and inflammation, especially after activity or long periods of rest. This discomfort can make even simple movements, like bending down to tie your shoes or walking upstairs, feel painful and challenging. The muscles surrounding the affected joints, which are responsible for providing stability and absorbing some of the joint's impact, can also weaken over time. As muscle mass decreases due to pain and inactivity, the joint becomes even more vulnerable to stress, increasing the risk of further damage. If osteoarthritis is left untreated, it can limit your range of motion, impair mobility, and affect your ability to perform daily tasks, ultimately leading to a decrease in independence. Managing osteoarthritis with exercise. While osteoarthritis may sound like a condition that should be avoided or rested, exercise is actually one of the best ways to manage and reduce symptoms. Low-impact exercises are especially beneficial because they allow you to keep your joints moving without putting additional stress on them. These exercises help maintain joint mobility, reduce stiffness, and strengthen muscles around the affected area, which can reduce pain and improve your overall quality of life. Best exercises for osteoarthritis relief. 1. Swimming. The buoyancy of water makes swimming an ideal exercise for individuals with osteoarthritis. Since water supports your body and reduces the impact on your joints, you can perform full-body movements with less pain and risk of injury. Swimming helps build muscle strength and flexibility, both of which are essential for improving joint function. 2. Cycling. Like swimming, cycling is a low-impact exercise that works your legs and improves joint mobility without putting pressure on your joints. Riding a stationary bike or cycling outdoors can help improve the strength and flexibility of the muscles around your knees, hips, and spine. 3. Tai Chi and yoga. These gentle forms of exercise focus on slow, controlled movements, balance, and flexibility. Tai Chi and yoga have been shown to reduce symptoms of osteoarthritis by improving joint mobility, reducing stiffness, and enhancing mental focus. Many yoga poses are designed to stretch and strengthen the muscles around the joints, which can help alleviate pressure and reduce pain. 4. Strength training. One of the most effective ways to manage osteoarthritis is by building muscle strength around the affected joints. By strengthening the muscles that support the joints, you can improve joint stability, reduce pain, and enhance mobility. Using light weights, resistance bands, or even body weight exercises can help you safely build strength without causing further harm to your joints. 5. Walking. While walking is a simple exercise, it's also incredibly effective for improving joint health. Walking regularly helps improve circulation, maintain muscle strength, and maintain joint flexibility. However, it's important to wear comfortable shoes and avoid walking on hard or uneven surfaces to reduce strain on the joints. The role of strength training in osteoarthritis. In addition to low-impact exercises, strength training plays a key role in protecting and supporting the joints. Strong muscles around the joints can help absorb shock and provide added stability, reducing the amount of stress placed on the joint itself. For example, strengthening the quadriceps, the muscles in the front of your thighs, can help reduce pressure on the knee joint, which is especially important for people with knee osteoarthritis. Strength training doesn't have to mean heavy lifting. Start with light weights, resistance bands, or body weight exercises, and focus on proper form to avoid injury. Aim to incorporate strength training exercises that target the legs, core, and upper body at least 2 to 3 times a week for optimal benefits. Managing pain with proper techniques. If you experience pain or discomfort while exercising, it's important to listen to your body and avoid pushing through pain. Consider the following tips to help manage osteoarthritis pain while exercising. Warm up and cool down. Always begin with a gentle warm-up and end with a cool-down session. This helps prepare your muscles for activity and promotes relaxation afterward. Use proper form. Ensuring you perform exercises with the correct form can prevent unnecessary strain on your joints and muscles. Start slowly. Gradually increase the intensity of your workouts as your body adapts. Start with shorter sessions and build up over time. Take breaks. If you feel fatigued, take short breaks to rest and recover. 7. Medication-induced myopathy. As we age, it's not uncommon for healthcare providers to prescribe medications to manage various health conditions, from high cholesterol to blood pressure and beyond. However, some medications, particularly statins used to lower cholesterol, can have a side effect that affects muscle health. This condition, known as medication-induced myopathy, can lead to muscle weakness, pain, and in some cases, muscle inflammation. Medications can interfere with the way your muscles function and repair themselves, sometimes leading to a noticeable decline in strength. This is because certain medications can impact the way your body processes nutrients or disrupt the normal function of your muscles. For people already dealing with aging-related muscle loss or other conditions, this side effect can be particularly problematic, leading to increased difficulty in walking, climbing stairs, or even standing up from a seated position. How medication-induced myopathy affects the body. Myopathy caused by medications typically results in generalized muscle weakness that can make physical activity more challenging. Statins, which are commonly prescribed for managing high cholesterol, are among the most well-known drugs associated with muscle-related side effects. For some people, muscle pain, cramping, or even weakness in the arms or legs can occur shortly after starting the medication. The severity of these symptoms can range from mild discomfort to more significant impairment. While statins are incredibly effective at lowering cholesterol and preventing heart disease, their side effects, particularly in older adults, can significantly impact quality of life. People with existing muscle weakness or other conditions that affect their mobility may find it especially challenging to deal with this side effect. Other medications that may cause myopathy. Aside from statins, several other medications have been linked to muscle problems, including corticosteroids. Often used to treat inflammation, these medications can lead to muscle weakness over time, especially with long-term use. Antipsychotic medications. Some of these medications can affect muscle control and strength. Diuretics, commonly used to treat high blood pressure and heart failure. Diuretics can sometimes lead to muscle cramps and weakness due to electrolyte imbalances. Symptoms of medication-induced myopathy. The symptoms can vary, but some common signs include muscle pain or tenderness, muscle cramps or spasms, weakness in the arms or legs, difficulty walking or performing everyday tasks, fatigue or decreased energy levels. If you notice these symptoms after starting a new medication or increasing the dosage, it's important to consult your doctor as soon as possible. They can help determine if the medication is the cause of your muscle problems and suggest possible adjustments. Managing medication-induced myopathy. The good news is that there are steps you can take to manage and reduce the impact of medication-induced myopathy. Here's what you can do. 1. Talk to your doctor. If you experience muscle weakness or pain after starting a new medication, it's crucial to discuss it with your healthcare provider. Your doctor may recommend adjusting the dosage, switching to a different medication, or even prescribing additional treatments to help manage muscle health. In some cases, a different class of medication may be used that has fewer muscle-related side effects. 2. Stay active. Even if you're experiencing some muscle weakness, it's important to stay active. Low-impact exercises, such as walking, swimming, or cycling, can help maintain muscle function and prevent further weakness. Focus on exercises that don't strain your muscles too much but still promote strength and flexibility. Always consult your doctor before starting any new exercise regimen, especially if you're on medications that could affect your muscles. 3. 4. Maintain a balanced diet. Nutrition plays a key role in muscle health. Ensure that your diet includes plenty of protein, vitamins, and minerals that support muscle repair and function. In particular, vitamin D and calcium are crucial for muscle and bone health, while magnesium can help prevent muscle cramps. 5. 6. Stay hydrated. Some medications, particularly diuretics, can lead to dehydration and electrolyte imbalances, which can exacerbate muscle cramps and weakness. Drinking plenty of water throughout the day and ensuring a balance of electrolytes, like potassium and sodium, can help maintain proper muscle function. 7. 8. Strength training. Even if medication-induced myopathy has weakened your muscles, strength training can help rebuild muscle mass over time. Focus on light weights or resistance exercises that target major muscle groups, starting with low intensity and gradually increasing as your strength improves. Conclusion: medication-induced myopathy can be a challenging side effect of certain medications, but it doesn't have to define your ability to stay active and maintain a high quality of life. By working closely with your healthcare provider, maintaining an active lifestyle, and nourishing your body with the right nutrients, you can combat the effects of medication-related muscle weakness. If you notice any unusual muscle pain or weakness after starting a medication, don't hesitate to reach out to your doctor to discuss alternative options or treatment plans. 8. Osteoporosis. Osteoporosis is a condition that affects many people as they age, particularly postmenopausal women and older adults. It causes bones to become brittle and weak, making them more susceptible to fractures even with minor falls or injuries. When osteoporosis weakens the bones in your legs and other parts of your body, it can have a significant impact on your ability to stay active. The risk of painful fractures or loss of mobility increases, often making it more difficult to engage in regular physical activity and maintain an independent lifestyle. While the idea of brittle bones may seem daunting, osteoporosis is not an irreversible fate. In fact, with the right approach, you can slow down bone loss, strengthen your bones, and reduce the risk of fractures. The key lies in a combination of exercise, nutrition, and regular medical checkups. How osteoporosis affects bone health. Bones are constantly in a state of renewal. Old bone is broken down and replaced with new bone tissue. As we age, especially after the age of 30, our bodies begin to break down bone tissue faster than we can rebuild it, leading to a decrease in bone density. In the case of osteoporosis, this process speeds up, and bones lose their strength. This is particularly noticeable in the spine, hips, and wrists, which are the most common areas for fractures. When the bones in your legs become weakened due to osteoporosis, even the simplest activities like walking or climbing stairs can lead to pain or injury, which can, in turn, make you hesitant to stay active. This lack of movement, however, can further accelerate bone loss and muscle weakness, creating a vicious cycle. The importance of weight-bearing exercises. One of the most effective ways to slow down bone loss and strengthen bones is through weight-bearing exercises. These exercises involve activities where your body works against gravity, which helps stimulate bone growth and maintains bone density. Here are a few options. 1. Walking, a simple and accessible way to maintain bone health. Walking can be done anywhere and is gentle on the joints. It's a great way to improve circulation and keep your bones engaged. 2. Weightlifting, strength training exercises, such as lifting light to moderate weights, can significantly help with maintaining bone density. This kind of exercise strengthens muscles and bones, improving both stability and overall function. 3. Dancing. Activities like ballroom dancing or even just moving to your favorite music can improve balance and stimulate bones in your legs and hips, reducing the risk of falls. 4. Hiking. For those who enjoy the outdoors, hiking provides a more intense weight-bearing workout while also benefiting your heart and lungs. The uneven terrain forces your bones and muscles to work harder to maintain balance. 5. Tai Chi. This low-impact, flow-based exercise is perfect for maintaining flexibility and balance, reducing the risk of falls while stimulating bone health in the process. Nutritional support for stronger bones. In addition to physical activity, a healthy diet is essential for maintaining strong bones and combating osteoporosis. The key nutrients for bone health are 1. Calcium. This mineral is the building block of bone tissue. Good sources of calcium include dairy products like milk, yogurt, and cheese. Leafy greens like kale and broccoli. Fortified plant-based milks like almond or soy milk. Fish like sardines and salmon with bones. 2. Vitamin D. Vitamin D is crucial because it helps your body absorb calcium. Without enough vitamin D, your bones can become brittle, no matter how much calcium you consume. Good sources of vitamin D include fatty fish, salmon, mackerel. Fortified foods, fortified milk, cereals, and orange juice. Sunlight exposure. Try to get 10 to 15 minutes of sun a few times a week. 3. Magnesium. Magnesium works together with calcium and vitamin D to help maintain bone health. You can find magnesium in foods like nuts and seeds, whole grains like brown rice and oats, legumes like beans and lentils. 4. Protein. Bones are made up of protein, so maintaining an adequate protein intake is crucial for bone strength. Sources include lean meats, poultry, and fish, eggs, legumes, tofu and tempeh, dairy products, bone density testing, and medical options. If you're concerned about your bone health or at a higher risk for osteoporosis, it's important to discuss it with your doctor. Bone density testing is a painless and non-invasive way to assess how strong your bones are and whether you're at risk for fractures. This test measures the density of your bones in areas such as the hip, spine, and wrist. If your bone density test shows that you have osteoporosis, there are medication options available that can help slow down bone loss or even increase bone density. These may include 1. Bisphosphonates, medications that help prevent the breakdown of bone. 2. Hormone replacement therapy, HRT for women. HRT can help maintain bone density by replacing hormones that decrease after menopause. 3. Selective estrogen receptor modulators. SERMs. These medications act similarly to estrogen and help prevent bone loss. 4. Bone-building medications. Medications that stimulate bone formation to help build new bone tissue, reducing fracture risk and maintaining mobility. In addition to medical treatment and exercise, there are other ways to reduce your risk of fractures and maintain independence. 1. Fall-proof your home. Make sure your living space is free of tripping hazards. Remove rugs, secure loose cords, and add handrails in key areas like bathrooms and stairways. 2. Wear proper footwear. Shoes with non-slip soles can help prevent slips and falls, which is especially important for those with weakened bones. 3. Stay active and maintain a healthy weight. A healthy weight reduces the strain on your bones, while regular movement and exercise keep muscles strong and joints flexible, reducing the likelihood of fractures. Conclusion: while osteoporosis is a significant health concern, it's not something you simply have to accept. By incorporating weight-bearing exercises, focusing on a calcium and vitamin D-rich diet, and staying proactive about your bone health, you can slow the progression of osteoporosis and maintain a strong, independent lifestyle for years to come. If you're concerned about osteoporosis, make sure to talk to your doctor about bone density testing and the best treatment options for you. With the right steps, you can stay active, strong, and injury-free, even in your later years. 9. Obesity and sarcopenic obesity. Obesity has long been recognized as a major risk factor for a range of health problems, from heart disease to diabetes, and it can also severely affect the health of your legs and muscles. Excess body weight increases the stress on your joints, particularly in weight-bearing areas like the knees, hips, and ankles. This added pressure can lead to joint pain, reduced mobility, and even joint degeneration over time. Additionally, carrying extra weight places more strain on your muscles, making them work harder just to support your body. However, A lesser-known but equally concerning condition is sarcopenic obesity. This is a situation where muscle mass decreases while fat mass increases, which can be particularly detrimental as it weakens muscle strength while promoting fat accumulation, especially around the abdomen and thighs. As we age, this imbalance becomes more common, leading to a loss of muscle tone and reduced muscle function. When it affects the legs, this can make basic movements, such as standing, walking, or climbing stairs, feel more difficult and tiring. How obesity affects leg strength and function. Obesity impacts leg strength in several ways. 1. Increased load on joints. Carrying excess weight puts additional pressure on your knee, hip, and ankle joints, which can increase the risk of osteoarthritis and other joint conditions. This, in turn, can affect your ability to move freely, resulting in reduced mobility and leg weakness. 2. Reduced muscle efficiency. The accumulation of fat and loss of muscle mass associated with sarcopenic obesity leads to weaker muscles that are less efficient at performing everyday tasks. As muscle mass declines, the body's ability to carry out activities that require strength, like standing up from a seated position, walking long distances, or climbing stairs, becomes more difficult. 3. Increased fatigue. The added weight of fat also leads to increased fatigue and reduced stamina. As your muscles struggle to compensate for the lack of strength, the effort required for movement increases, making even simple activities feel exhausting. 4. Decreased balance and mobility. With both muscle loss and excess fat, your overall balance and mobility become compromised. This increases the risk of falls and makes it more difficult to engage in physical activity. Over time, this can lead to further muscle loss and a continued decline in leg strength. Fighting obesity and sarcopenic obesity. A dual approach. The good news is that obesity and sarcopenic obesity are not conditions you have to accept. With the right combination of diet, exercise, and lifestyle changes, you can reverse muscle loss, shed excess fat, and improve leg strength. Balanced diet for weight loss and muscle maintenance. 1. Calorie control. Reducing excess body fat requires a caloric deficit, meaning you need to consume fewer calories than your body burns. However, this should be done carefully to avoid losing muscle mass. Focus on a nutrient-dense diet that supports muscle maintenance while helping you shed excess fat. 2. Protein intake. Protein is crucial for maintaining and building muscle. A high-protein diet helps preserve muscle tissue while losing fat. Include lean protein sources such as chicken, turkey, and fish like salmon, eggs, legumes, beans, lentils, Greek yogurt, and cottage cheese. 3. Healthy fats and carbs. Include healthy fats like those from avocados, nuts, and olive oil, as well as complex carbohydrates from sources like whole grains, sweet potatoes, and vegetables. These foods provide sustained energy without contributing to fat accumulation. 4. Avoid processed foods. Minimize the intake of sugary snacks, fried foods, and refined carbohydrates. These contribute to fat storage and can hinder weight loss efforts. Exercise. Strengthening muscles and losing fat. A combination of resistance training and cardiovascular exercise is the key to combating obesity and sarcopenic obesity. 1. Resistance training. Building and maintaining muscle is essential when combating sarcopenic obesity. Incorporate exercises like weight lifting or dumbbell exercises to target large muscle groups. Bodyweight exercises like squats, lunges, and push-ups. Resistance bands for full-body workouts. Resistance training helps increase muscle mass, improve strength, and boost metabolism, making it easier to lose fat while maintaining muscle. 2. Cardiovascular exercise. In addition to strength training, cardio exercises like walking, cycling, swimming, or jogging help burn calories, reduce body fat, and improve cardiovascular health. Aim for at least 150 minutes of moderate-intensity cardio per week. 3. Low-impact activities. For those with joint pain or mobility issues, low-impact exercises like swimming, cycling, or walking are effective ways to improve endurance and leg strength without putting undue stress on your joints. 4. Flexibility and balance exercises. Activities like Tai Chi or yoga are great for improving balance, flexibility, and overall mobility. These exercises also promote muscle function and prevent falls, which can be more common when obesity or sarcopenic obesity affects your legs. The role of regular monitoring. As you work towards losing fat and maintaining muscle, It's important to regularly track your progress. Regular weigh-ins, body composition measurements for muscle versus fat, and even fitness assessments, such as measuring strength or endurance, can help you gauge how well you're progressing. Key takeaways: reversing obesity and sarcopenic obesity. 1. Diet. Focus on a balanced, nutrient-dense diet rich in protein, healthy fats, and complex carbs, while reducing processed foods and excess calories. 2. Exercise. Incorporate both strength training to build muscle and cardio to burn fat. Be sure to include low-impact exercises for joint health. 3. Lifestyle changes. Consistency is key. A long-term commitment to healthy eating and regular exercise will help you overcome obesity and sarcopenic obesity and improve the strength and function of your legs. 4. Consult a professional. If you have concerns about obesity or sarcopenic obesity, consider speaking with a healthcare provider, nutritionist, or personal trainer who can guide you in creating a safe and effective plan tailored to your specific needs. By focusing on a combination of proper diet, exercise, and lifestyle changes, you can break the cycle of obesity and sarcopenic obesity, ultimately improving your muscle strength, reducing the risk of injury, and reclaiming your mobility and independence. 10. Stroke. A stroke is a serious medical event that can have long-lasting effects on both your brain and body. When a stroke occurs, it disrupts the blood supply to the brain, leading to potential brain cell damage. Depending on which area of the brain is affected, a stroke can impair various functions, including the ability to move, speak, and think clearly. One of the most common and noticeable effects of a stroke is weakness or paralysis on one side of the body, which can severely impact the muscles in your legs. After a stroke, it's common for one leg to become weaker or even immobile, making basic tasks like walking, standing, and climbing stairs difficult. This weakness occurs because the brain's ability to send signals to the leg muscles is impaired. When the brain cannot communicate properly with the muscles, they lose their strength and ability to function effectively. However, the good news is that recovery is possible with physical therapy, gait training, and the appropriate use of mobility aids. Understanding the effects of stroke on leg strength. 1. Unilateral weakness. Hemiparesis. The most common result of a stroke is hemiparesis, which is weakness or partial paralysis on one side of the body. This often affects the leg, making it harder to move and perform even simple actions like walking. The muscles on the weaker side are unable to function at full capacity, causing difficulties with mobility and stability. 2. Loss of motor control. After a stroke, the brain's ability to send signals to the muscles can be compromised, leading to loss of motor control. This means that even if the leg muscles are technically strong, the brain may not be able to trigger proper movement. This can make it difficult for stroke survivors to lift or move their legs, even though the muscles are not inherently weak. 3. Reduced coordination. Strokes often affect the coordination of movements. This can make it challenging for individuals to walk or stand without assistance, as the weaker leg may not work in sync with the stronger one. This can lead to a lack of stability and increase the risk of falls. 4. Muscle atrophy. Prolonged inactivity following a stroke can also lead to muscle atrophy or the gradual shrinking of muscles. This can worsen leg weakness and make recovery even more difficult, as the muscles become less responsive and lose strength. Rehabilitation and recovery. A path to rebuilding strength. While a stroke can leave lasting effects, recovery is possible with the right approach. The key to regaining leg strength and improving mobility after a stroke is a comprehensive rehabilitation plan. Here's what it typically includes. Physical therapy. One of the most important components of stroke recovery is physical therapy. A physical therapist works with stroke survivors to help them regain strength, improve movement, and rebuild coordination. Therapy usually focuses on specific exercises to target the weaker leg, improving muscle function and increasing range of motion. Therapists may use techniques like strength training, stretching, and balance exercises to rebuild muscle mass and improve the function of the affected leg. Regular sessions can help regain muscle tone and stability, which is crucial for restoring the ability to walk and move freely. Gait training. Gait training is a specialized type of therapy that helps individuals learn to walk again after a stroke. It focuses on improving walking patterns, balance, and the coordination of both legs. Gait training often uses techniques like assistive devices, such as walkers or canes, treadmill training, and various walking drills to help stroke survivors relearn the mechanics of walking. By practicing specific movements and using support tools, stroke survivors can improve their walking ability over time. This type of training can also help prevent future falls by improving balance and mobility. Mobility aids. For some individuals, mobility aids such as walkers, canes, or wheelchairs may be necessary to regain independence and mobility. These devices help support the weaker leg while walking, providing stability and balance. They also reduce the risk of falling, which is especially important when one leg is significantly weaker after a stroke. Over time, as muscle strength improves through rehabilitation, the reliance on mobility aids may decrease, allowing the person to walk more independently. Strengthening and stretching exercises. Even after physical therapy, continued strengthening and stretching exercises are important. Exercises like leg raises, squats, bridges, and ankle pumps can help rebuild muscle mass and restore strength. Stretching exercises can improve flexibility, reduce stiffness, and prevent further injury to the muscles and joints. Additionally, incorporating aerobic exercises, such as cycling or walking with support if needed, can increase overall cardiovascular health and endurance, further supporting the recovery of leg strength and mobility. Prevention. Reducing stroke risk factors. While recovery is possible after a stroke, prevention is always the best approach. Here are some proactive steps you can take to reduce your risk of stroke and maintain leg strength. 1. Manage blood pressure. High blood pressure is one of the leading causes of stroke. Regularly monitoring your blood pressure and taking steps to manage it, such as through medication, a healthy diet, and exercise, can significantly reduce your stroke risk. 2. Healthy diet. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help maintain a healthy weight and support overall cardiovascular health. Reducing salt intake and avoiding high-fat or processed foods can also help control blood pressure and cholesterol levels. 3. Exercise regularly. Staying active is essential for preventing strokes. Regular aerobic exercise, such as walking, swimming, or cycling, can improve circulation, lower blood pressure, and reduce the risk of stroke. 4. Quit smoking. Smoking is a major risk factor for stroke. Quitting smoking can dramatically reduce your chances of having a stroke and improve overall heart and lung health. 5. Limit alcohol consumption. Excessive alcohol intake can raise blood pressure and contribute to heart disease, both of which increase the risk of stroke. Limiting alcohol consumption to moderate levels can help protect against stroke. 6. Monitor cholesterol. High cholesterol can contribute to the formation of plaque in the arteries, leading to stroke. Eating a heart-healthy diet and managing cholesterol through medication, if necessary, can help prevent blockages in the arteries. 7. Stress management. Chronic stress can elevate blood pressure and contribute to heart disease, increasing the risk of stroke. Practicing stress-reducing techniques such as meditation, deep breathing, and yoga can improve your overall well-being and reduce stroke risk. Key takeaways. Recovery and prevention after stroke. 1. Recovery is possible. Stroke survivors can regain leg strength and mobility through physical therapy, gait training, and the use of mobility aids. 2. Rehabilitation focuses on strength and coordination. A comprehensive rehabilitation plan, including strength training and coordination exercises, is essential to rebuild muscle and improve movement. 3. Prevention is key. To reduce the risk of stroke, focus on managing blood pressure, adopting a healthy diet, exercising regularly, quitting smoking, and reducing stress. 4. Stay positive and consistent. Recovery from stroke is a gradual process, but with the right support, perseverance, and dedication to rehabilitation, it is possible to regain strength and independence. Closing thoughts. Now that you know what's behind weakening legs and how to combat it, it's time to take action. Start today with small changes, maybe a walk in the morning or adding more protein to your meals. Consult your doctor to tailor a health plan that's right for you. Let's make a pact to age with strength, independence, and vitality. Share your thoughts below. What steps are you going to take today? Don't forget to subscribe to Health 365 for more practical tips and insights on staying strong and healthy through the years. Together, we can walk this journey with confidence.